The concept of telemedicine is not new. The origin of modern telemedicine applications starts in Europe when Dutch physician Willem Einthoven had transferred electrocardiograms in 1905. Communication technology was the base for telemedicine from the beginning. During early 20th century medical centers in Norway, Italy, and France, they used radio for consultations with patients on ships at sea. A more organized telemedicine system was established in the U.S. when transmission of radiographic images began in the early 1950s in the United States, following shortly thereafter by similar experimentation in Canada. Digital media and the internet greatly impact technology on healthcare services. New digital technologies enable healthcare providers to cross physical boundaries more easily than before. Hospitals, private practitioners, and health clinics have new opportunities to expand their reach outside traditional in-person service delivery. It now allows healthcare access to more remote areas where access to quality medical support is difficult, and this is a larger market for firms. It also allows patients to receive medical consultations from the comfort of their own homes rather than requiring a trip to a waiting room. This idea of telemedicine and the thought that medical consultations no longer have to be conducted by face-to-face, in-person interactions is evident today in many medical arenas and in many hospitals, such as Brigham and Women's Hospital, BWH, which is actively preparing for the era of virtual care. In 2015, BWH began with video-based visits for outpatients with chronic diseases due to their traditional requirement of frequent follow-up visits and infrequent physical exams. By moving these follow-up visits into a digital platform, participating providers free up more time to see patients, and the patients receiving the follow-ups can do so on their own time and where they are most comfortable. 97% of patients surveyed were satisfied with the experience and would recommend the program. 74% felt that the interaction actually improved their relationship with the provider. 3 key questions in telemedicine are: who are the telemedicine potential customers? Which patients' health problems could be solved by telemedicine? And how could marketing help telemedicine service providers? The idea that patients could get the best possible advice or diagnosis not just from their local hospital, but from the best possible healthcare providers in a specific field is very valuable not just for consumers, but for service providers and pharmacies as well. This is a radical change in the way that service delivery has been working in the past. For example, a family doctor could expand its reach even if the person or whole family moved from their initial place of living. Digital technology has reduced the gap so that distance is not an issue anymore. First, it starts with a simple search for advice on community forums about a specific condition or health issue, or making a simple appointment within local hospitals through websites or SMS. Here are some examples where telemedicine adds value for all participating sides.
The second example is a service offered by the company Alternative. They offer the most convenient and affordable way to receive a vision prescription online. Unlike traditional methods of vision test, where you need to go inconveniently into an optometrist office and pay an exorbitant amount of money, you now have the ability to do this all in the comfort of your own home. The Alternative Vision Test is a first-of-its-kind technology that connects patients to providers and allows patients to receive a prescription after completing a short online vision test. Without leaving home, consumers can now get a physician-approved prescription in 24 hours or less for $40 for glasses or contacts, or $60 for both. The way the test works is simple. Users sign up on the main website, alternative.com, and enter some very basic demographics: age, medical history, and their cell phone number. They then receive a text message that pops up on their smartphone, creating a link that opens up a browser, transforming their smartphone into a remote control that controls their computer. The test has audio prompts that guide you through the entire process, asking you multiple choice-based questions such as which side of the screen looks a little bit sharper. And after about 10 minutes, all the results are sent to an ophthalmologist to review and sign off on. It's fast, efficient, and very cost-effective. Telemedicine is the remote delivery of healthcare services such as health assessments or consultations over telecommunications infrastructure. It allows physicians to evaluate, diagnose, and even treat patients without the need for an in-person visit. The core technologies of telemedicine include those that collect data, such as wearables, sensors, and even vital sign monitors, for instance, and those that enable communication like video consults, SMS messaging, mobile apps, and others, for instance. These 2 types of services will become an integral part of healthcare delivery.
Let's examine how telemedicine influences patients and healthcare service providers. Telemedicine enables more power shift from firms to consumers. Consumers can now pick the type of medical service they need and choose the best service provider possible. Consumers' day is more efficient and streamlined because scheduling is more flexible and more in consumer hands. Competition will bring benefit to the consumers, like better price options and more choice. Consumers could find useful information on social media sites where company or doctors are giving professional advice over specific condition, treatments, or groups. For example, a patient-focused network such as Robin Hood Children's Hospital is built around a particular group, children. Social networks usually mean to convey general health information and sometimes even personalized help. At the same time, healthcare providers are using digital media to expand their influence and offer their services. Members of the medical profession are embracing social media for sharing helpful medical information and providing patient care. Using digital advertising service, providers could expand their markets using social networks that are able to better understand the needs of consumers. Firms could have their consultants within patient-oriented social networks and provide medical advice, plus advertise products and services. In some cases, the appointments will need only video streaming connections between patients and the doctor. Here are some key questions related to the marketing and telemedicine. Who are the telemedicine potential customers? Families with kids in remote areas or military personnel around the world, people in war zones or older people in urban areas. Which patients' health problems could be solved by telemedicine? To have a clear answer to this question is important for every telemedicine provider. One could define the product and marketing strategy. How could marketing help telemedicine service providers? As the telemedicine can take place on the same platform that the promotion display is on, it provides a great marketing opportunities.
One journal article relating to telemedicine, its effectiveness, and the marketing potential as a result comes from the American Journal of Managed Care. The study referenced in this article made use of remotely delivered health interventions rather than physical interactions with healthcare professionals and the subsequent impacts on the overall healthcare environment. Initial results of the 6-month study found that when virtual care is incorporated into a patient's health monitoring ecosystem, rather than sole reliance on traditional health monitoring with face-to-face interaction, the patient's overall health improved more than the control group, the time spent in the hospital was reduced, and the individual medical costs decreased dramatically. The study proves that, at least for certain medical cases, remotely delivered healthcare can safely and effectively move patients from the current standard of in-person medical consultations and checkups to having the opportunity to obtain the medical advice from their caretakers from the comfort of their own homes and the convenience of their own schedules. The second article relating to telemedicine comes from the Journal of Psychiatric Services. For patients with mental illness, services like telemental health services from the U.S. Department of Veterans have shown to improve quality and efficiency of care. As a result of using THS, between 2006 and 2010, psychiatric admissions of telemental health patients decreased by an average of 24%, and the patient's days of hospitalization decreased by an average of 27%. As virtual mental care streams toward us and the concepts are continually proven out, there will soon be a day when providers will be deciding not whether to offer telehealth, but how often. The hospitals and healthcare professionals will be the first to realize the benefits of telemedicine for themselves, but more importantly for the patients they are caring for. This use of digital technology is a win-win for both parties involved, but changing old habits, i.e. physical care, is not a simple feat. Now that the effectiveness and benefits of telemedicine have been explained for both the providers and the patients, a few recommendations are considered in order to bring this concept to mainstream healthcare. These recommendations include using social media to expand the influence of telemedicine, embracing the tech-savvy tendencies of younger generations, creating digital health support teams with consumers in mind, and informing patients of the benefits of remotely delivered care. The following slides will expand upon these recommendations as well as explain how some of the recommendations are already in use today.
Simultaneously, healthcare providers are using digital media to expand their influence and offer their services en masse. Members of the medical profession are embracing social media for sharing helpful medical information across networks and providing patient care. Doctors, acting as both firms and consumers, are learning how to use social media for their patients and their own benefit. For example, Doximity is a social network with over 400,000 members that represents about 50% of doctors in the United States, according to the company. Healthcare professionals are using these networks to seek advice, advance their careers, or look for new jobs, products, and services. Using targeted advertising, service providers could expand their market. Using social media, firms are able to gain an understanding of what types of support these medical-related users are looking for. Firms or individuals could market their services within patient-oriented social networks, provide medical advice, and advertise their products and services. By marketing services within these networks and using a telemedicine platform, a private, self-employed nurse could work with the might of an office, cost-effectively caring for hundreds of patients at a time, keeping them healthy and happy in their homes and away from costly emergency rooms and hospital beds. As a result, survival rates improve, costs decline, and the firm and the consumer move closer together because of targeted marketing. Based on the activity level of patients and health service providers, we have developed a simple 2x2 matrix, which gives us 4 different types of telemedicine applications. Given the nascence of the sector, digital marketing opportunities are diverse and applicable across all sections of the ecosystem. This further reinforces telemedicine as a catalyst for disruptive digital marketing. So for all of you entrepreneurs out there, please jump in.